Good morning, everybody. I'm Karim Berkouk from the European Commission. And I'm working on non-communicable diseases and also on the challenge of healthy aging. So today I will review a little bit the EU effort in epilepsy research, a little bit about the past, the evolution, I hope the impact of your research, and what's coming next for the next framework program. So about the burden, of course, you're all aware about the burden of epilepsy. About 6 million people in Europe suffer epilepsy, but what I want to emphasize is the global challenge that we are facing, in particular with 68 million around the world. And knowing that in some countries access to care is extremely difficult in a complex disease like epilepsy, we are facing, in particular in low and medium income countries, a big burden that we need to face. Also in terms of economics, epilepsy represents a burden of about 2.6 billion per year in Europe, particularly because it affects all ages, and in particular people who are working in work, that are able to work because of the condition cannot go to work. So it's a huge economical burden also. And we should emphasize that, in particular, with the aim of getting more funding into research. The challenges of epilepsy, of course, the ultimate challenge is about prevention. But until we can prevent, we need to really find ways to diagnose much earlier epilepsy. We lack also of effective treatments for 30 to 40%, probably because the way we treat patients is more targeting the symptoms rather than the pathophysiology of the disease. We're also facing a large spectrum of disorders. Epilepsy is very heterogeneous. I think we should target subcategories of epilepsy and go forward towards a more stratified approach, or what we call personalized medicine. Also, there are many links between epilepsy and other conditions or the disorders like traumatic brain injury, depression, mental disability, autism. So sometimes it's the cause and sometimes it's the consequence, and I think if we understand a bit better those interaction, we will be able to target it and to treat it much better. And there is also a big social stigma around epilepsy in developed countries, but even more in the low and medium income countries. And that's a big burden for the people, especially in the third country where they have three-quarter of the people do not have access to treatment in epilepsy. So the decade of EU efforts on epilepsy. Here you see a graph about the cumulative funding in epilepsy research in the last 10 years, starting from the beginning of the previous framework program, FP7, which started in 2007. So you see that there are basically two big increases. One corresponds to in 2013, with a topic dedicated to epilepsy. And also at the beginning of Horizon 2020, even though it wasn't targeted, there was a big effort by the EU scientific community, and there was a big increase in the funding in epilepsy. We started with some project in 2008-9, but really the declaration by the European Parliament, the Recurrent Declaration of Epilepsy, was instrumental into the increased funding in epilepsy. This translated in two aspects, two initiatives from the Commission. One was by DG Research and Innovation, with a call specifically on epilepsy and mainly on the pathophysiology and the treatment of epilepsy, but also from DG Santé, an effort about the building up of a European reference network, as we have seen just before. And here we are after 10 years, all these initiatives, even though we always try to put researchers together, but it doesn't work very often. So it's good to see that you managed to do it without us, and probably better than we would have done. And in terms of funding, in the last 10 years, we have invested some 180 million euro in epilepsy. You will see here in terms of the type of research that we have funded, the bulk of it, about 60% of the 60% of the funding was about collaborative research, mainly through the health program. But we have increasingly frontier research from the European Research Council, and as we have seen before also from the Marie Curie, Marie Sklodowska-Curie, we have also about 20% of the funding which is coming from there. And also, I like to emphasize about your initiative, the fact that you're using the whole spectrum. We have Marie Curie, we have collaborative research, and we have DG Santé, and you are managing of putting that together in a coherent way, and I think this is to be noted. In terms of number of projects, overall this represents about 100 projects, participation from more than 400 participants from over 50 countries in the world. In the health program from FP7, about 7 projects have closed, and they have generated 260 publications. Impact factor average of those publications is 6.6, which is quite high, and 2 small and medium enterprises were created with 1 patent. So those projects are delivering both knowledge through high quality knowledge, but also innovation through the SMEs and the patent. Here I just want to show the funding in terms of regions in Europe. It's amazing to see that this kind of banana or croissant, as you want to call it, from south of UK, Netherlands, Belgium, going to Germany, Austria, and France at the end, and the north of Italy. If you look at the map from the Renaissance, like 400 years ago, the areas that were the most intense in terms of commercial activities are mainly the same, and we are 400 years after, we still have this activity map, if you want, and which is reproduced here. I also like to show the regional funding, because sometimes we think big country, for instance, in that case France, they get a lot of funding, but you will see that it's very concentrated in a few regions. It's not the whole country that is active. And also it shows a kind of centralization in some countries, like the highest region getting fund is London, followed by Paris, the big city, basically. So how do we work at European level? Well, basically it's all about collaboration and partnerships. We have, let's say, 4 main areas: the collaborative research that I've mentioned a bit up to now, but we have also partnership with other public authorities. That's what we call public-public partnerships. We partner also with the industry. That's what we call public-private partnership. And we also partner with international funders outside Europe, and that's what I call the global cooperation. So now I will just focus a little bit on each of those. Of course, here today we have the epiXchange, this network of 7 projects, 6 from research and another one from DG Santé on the European reference networks. It's very pan-European, and what I like about your initiative, it's really because it's also bottom-up. It's really the need of the researchers that take their own destiny somehow and want to achieve something together. And that's really, I think, what makes the spirit of Europe also, how when we are together we achieve much more than staying in our own lab. In terms of public-public partnership, you are all aware that the funding from the EC represents between 5 to 10% of the funding that is available in Europe. About 90 to 95% of the funding, public expenditure in research, are coming from the member states. So there is a big effort on coordinating those research programs or policies. We are trying to align national policies towards a common goal. We're trying to facilitate the co-investment between the countries, and also we're trying to show what are the best practices in different member states so that the others can pick it up. And we did that in brain diseases, we did it on neurodegenerative disease, but also on non-neurological diseases like epilepsy. In particular, through the ERANET neuron, there have been some topic. Oops. Yeah. Oh, that was too much. Sorry. We also invested with the member states on this large project, which was the Human Brain Project. I know that it was a bit controversial at the beginning because it was thought to be too IT focused and not enough cognitive focus. But really, what they are trying to do is really to provide an infrastructure for brain research. And I think the success of HBP will depend on you, how you will use this infrastructure, how you can feed data and how you can use this infrastructure to analyze your data, to use data from others. So I really recommend that you use that infrastructure to develop, to foster your research. We partner also with the private sector, in particular with the pharmaceutical sector in Europe, FPA, through the Innovative Medicine Initiative. We had IMI in FP7, and we have the successor, which we call IMI2. They have invested quite some substantial funding in brain research with about 250 million in this area. And what's really encouraging about that is that, as you know, in the 20s, most of the pharma companies had left a little bit the brain area because of the complexity of the disease. We didn't know enough at the time to develop a new medicine. And through IMI, I think because it was pre-competitive field, they started again investing in research, and that's good news for the patients and for everybody on the fact that the industry is back into the brain area. Oops. No. I think, okay. And we also trying to coordinate with global funders from most of the world. And the way we do it is we gather together with the NIH, CIHR from Canada, Australia, India, China, South Africa, really 15, 20 countries representing the whole world. And usually the way we work is that we try to find a common aim. We then each one funds its own research or research group, and then the researchers work together. That's the model that we are using in the last 7 years, and here you have examples of that. We do that on traumatic brain injury, we do that on chronic diseases, on rare diseases, on the preparedness of outbreaks, but also in cancer genome. And that's the model that we are mainly using for international cooperation. We are pleased to have some successes out of this research. Many of the success will be mentioned today. And also the fact that we are really, you're showing what we are trying to do. What I mean is that we really, when we develop a topic, we really aim at delaying the onset of epilepsy, or how we could have simple tests to detect epilepsy very early. And here are two, three examples: the ERA, Desire, EpiStop, EpiRNA, and EpiTarget. They are really the type of research that we are trying to push. Of course, in our mind it's very theoretical, but you make concrete example of how this can be done, and I really think those are real successes of research in general, and I praise that. But we also have other projects outside this, let's say, network of 7 projects that also have delivered. One is called Epilepsy, which aim at alarming the patients just before the seizure happens, so that they can prepare, get some treatment, or they can isolate themselves so that they are not seen in public. We have another project which is called NeuroOpt, and here it's more about imaging, how you can understand a bit better the functioning of the brain, in particular through novel photonic devices. But also they have built a helmet for attaching the optical fibers to the head. So these are just some examples beyond your project that also maybe would be interesting in the future to incorporate into your network. Sorry, I'm not very good at that. Okay, I've talked about your achievements. Now I will spend the last 5 minutes speaking about what's coming next. And in particular, the work program 2019 and 20 have been published. There are many areas, as you know, we are not disease focused anymore, so many areas where your research could to work. I just mentioned a few of them that are particularly relevant. For instance, understanding the causative mechanism in co- and multimorbidities. It will be an update in July, and the comorbidities are mental and physical comorbidities. So the mental aspect will have to be taken into account in these comorbidities. We have topics about new therapies for NCDs, also about the management of multimorbidities in the elderly, but also about screening, about early detection of diseases. All these are opportunities in the next 2 years that you will be able to apply to. I also mentioned, even though we just closed the topic on coordinated and support action, because they are extremely relevant to what you're doing. One is about how we can coordinate better European brain research in Europe, how we can basically build networks like you are doing, but how we can facilitate that in the future so that it becomes a bit more systematic. at European level in the first stage, but also how we can coordinate the large brain initiatives in the world that are coming out. You know that after HBP, many countries have announced a large brain initiative with the US brain initiative proposed by Obama. But after that, we have had the Australian with their own brain initiative, the Canadian, the Chinese, Israel. Many of those countries are developing the brain initiative. How can we bring those together? So that's one of the aim of this support action. And the other one is very similar, but it's about cohorts. You know that in Europe we have a long tradition of cohorts. It's this tool which is instrumental in whatever progress in medicine we are doing. And what we have been trying in the last years is how we can bring national cohorts together at a European level. And this coordinated and support action will, in the first stage, map all the cohorts in Europe with, and characterize them so that it will facilitate for the researchers to know where can I use data from what and what was the data that was collected and how. And also propose a strategy for the future, how we can build a more systematic approach to cohorts at European level. And I also mention, okay, those are the topics that, from the European Commission, from our work program, but through the other initiatives like IMI, there are many opportunities also for epilepsy research. We have also possibilities under the Human Brain Project and also through the Neuron ERANET. Many opportunities will come up in the next years. So, as you have seen, I think it's 2 weeks ago, we have proposed, the Commission has proposed the next framework program. It's not Horizon 2020 anymore, now it's Horizon Europe. We are proposing 3 big pillars. One, which is on open science, and there you will find most of the bottom-up research, like the European Research Council, the Marie Curie, but also the research and infrastructure programs. In the second pillar, which is about the global challenges, we will have basically the societal challenges that we had in Horizon 2020. And the health program will sit on this second pillar on global challenges. And then we have a third pillar, which is about open innovation. And there you will have, I think, one of the biggest novelty of Horizon 2020 will be the creation of a European Innovation Council, mimicking a little bit the European Research Council program, but just for innovators. And all the innovation aspect of our research will be centralized into that pillar. So that's the structure. That's the funding. That's what we are proposing. Of course, now the member states and the parliament will have to decide, either reduce it, either increase it. But for the time being, the Commission has been quite ambitious in increasing the budget from the 80 billion for Horizon 2020 to 100 billion in Horizon Europe. And this is taking into account the fact that the UK is not foreseen to participate into this budget. So it's another 13% less in terms of contribution. So it shows that the increase is really about 30% more than Horizon 2020. So it's I think ambitious proposal from the Commission. We count on you to go and see your national authorities and to tell them that you really support this increase, and why not even increase it. But that will be decided in the next 8 to 10 months, the final figure. And we will propose, you will see the beginning of June, what we call the specific program, which goes basically onto the 3 pillars. You will see exactly what's the plan for the next 7 years, and that will be published at the beginning of June. Beyond the European Innovation Council, the main novelty for you is the mission-rated approach. This comes from the interim evaluation report that was done by a high-level group chaired by Pascal Lamy. He recognized the success of Horizon 2020, but he mentioned that we could maybe have more impact by going towards a mission-oriented approach, and that's what we are proposing in Horizon Europe. And this mission approach has been detailed a little bit more in the report made by Professor Mazzucato, and here are just putting the criteria that will be used to select the mission in Horizon Europe. Bold, inspirational, clear direction, but still ambitious, but still realistic. It should bring together many sectors, and part of the solution should be bottom-up, so left to the people, just researchers, social innovators, just the aim, and up to the people to find a solution to reach the aim. Okay, that's a novelty in Horizon Europe. What I want to emphasize is that, excuse me, this won't be, we won't only do mission type of research. This will represent 10 to 20% of the budget. 80% of the budget will be regular research as we have done in the past, because many research communities are worried that if they don't have a mission, they won't have any opportunities to do research, but that won't be the case. This will be a specific focus of the research program. And I think I will okay, my last slide is only about the conclusion. I think that have shown that your research is really delivering what matters to patients, with many advances in brain imaging, genetic and metabolic investigations. You have identified some 130 subcategories of epilepsy. You are impacting clinical practice on better diagnosis and care for patients, in particular through the European Research Reference Network. Sorry, and I think that that shows that Europe is playing a big part into the progress in epilepsy. So I think you are just showing that when we work together, we can just do it better, we can just do more and faster. We have done a decade up to now of research since 2007. I think that with the end of Horizon 2020 and the beginning of Horizon Europe, you are now ready to start a new decade of AU research. Thank you very much.